Yeah, so today I think the penetration of IT is very deep in healthcare as well as in hospitals. We see devices, we see almost everybody connected to not only just a chat session or an email, but even to the core images and scans and a patient records and things. Everything is available pretty much at a click of a button. Uh, and, and, and the penetration has really improved there. It is beyond just as I said, patient records or just a hospital management system. The entire history today can be pulled out on any kind of a device, and that doesn't depend whether I'm in the hospital or I'm outside. Today the IT and technology has matured that I can securely deliver the same patient records and a hospital management system anywhere around wherever I am. I may be holidaying in the United States, whereas I need to prescribe something to my patient in Mumbai. It's pretty much doable at a click of a button today, and I don't have to make some frantic calls to really understand or say that I as a specialist is missing. So the penetration is very high. It's very mature, and now the next layer which is coming across is how much more can we optimize for the infrastructure and bring the cost down for servicing the patient. So infrastructure plays an extremely important role when it comes to running the hospitals or making the hospital effective. What was seen as only a one core hospital management system or a few clinical based or research based work to be done is pretty much become now a very horizontal approach. The infrastructure is required to run the core hospital systems. It's even required to run the support systems which the staff as well as the specialists need. And some of it is not seen by the patients or by the doctors and by the core hospital employees, but it pretty much enables whether it's your messaging systems or whether it's your network running from one department to another, or the billing, or all the surround support systems around it. So, and the way it has changed over the last period of about 3 to 5 years is that a lot more consolidation has happened. No longer do you run silo systems and silo infrastructures for a hospital A location or a B location. A lot of it has been virtualized, a lot of it has been consolidated, and now with the networks improving, the IT departments are much at ease by centralizing these infrastructures and running the service very smoothly for hospitals. What's important here to understand is not just what a vertical called hospital or anything related to healthcare. It is what level of service you want to achieve, and what's your readiness internally within the organization. Sometimes you focus on your business and not so much on the support things. So it makes sense for you to not really employ fat salaried people, but just outsource the entire work to specialists who can run this as a day-to-day exercise and a job for them. But there could be a large chain of hospitals and large chain of manufacturing facilities in the healthcare side who really want to control and optimize the infrastructure. So it is really a choice of whether we want to focus on the business side, or do I have the required set of people and manpower internally to manage that core infrastructure. Because what is not acceptable to the management or to the hospital systems is service being down. Is the infrastructure not scaling up to what you need today? And the needs of the healthcare industry are so diverse that the volume of data, the type of data really is immense. We may not realize, but there are terabytes and petabytes of data which gets generated, and when you need it at a millisecond response. So it does put stress onto the core infrastructure, and the team who supports this from a day-to-day perspective really have to be up at their time and really support it very well. So it is entirely depending on the strategy that the hospital has, whether you completely push it out as a service or really bring about the expertise within the hospital's technology systems to scale this up. So a lot more is yet to happen. Many hospitals today try and control a lot of information within their premises and in-house, and they not necessarily use cloud as a services to scale this up. As cloud matures, as service levels improve, and as infrastructure even furthermore improves, even in India or a tier 2, tier 3 cities, we will see cloud really becoming the enabler for historical data, for transactional data, as well as for some of the newer things which will come up from a devices and agility perspective. So we really see cloud playing a great role for these hospitals as well, and not just some .com companies and e-commerce companies.